Hello everyone, this is Reema from Clinicspots. Today we are here with Dr. Leena Jain. She's a renowned plastic and reconstructive surgeon in Mumbai. So today is, as we all know, that today is International Plastic Surgery Day. We'll have a little conversation with her and we'll talk about some misconceptions about plastic surgery. Hello, Dr. Leena.
Hi, I'm Leena Jain, plastic and reconstructive surgeon, and it's my pleasure to be here with you and clear a few misconceptions and throw light on the importance of International Plastic Surgery Day.
That is really so nice of you, and we really value your time and effort. So, Dr. Leena, let's start by addressing some misconceptions about plastic surgeries. What are the myths that you generally, come across, and what patients ask you, I'm sure, and how do you make your patients understand about the reality of the plastic surgery?
Yeah, okay. So, some very common misconceptions are actually unbelievable also, but patients really have these doubts. The first thing that patients ask a plastic surgeon is, will there be a scar after surgery? So the minute a patient thinks that we're going to a plastic surgeon or a plastic surgery is going to be done, they expect that it's going to be magical. But look, scarless, there's not going to be any mark, but that is not true. So the first thing about our skin is scar is inevitable surgery result of any surgery. Whether it's a surgery or an injury, when there is a knife falling on your skin and making a cut, a scar is going to be there. So the difference in the scar that a plastic surgeon will give is that the scar will be much more appealing. Either it will be concealed or hidden in natural skin creases or in parts of the body where it can be barely visible. And even if it is visible, the outcome of the scar will be much more superior than a scar that will be received from a general surgery procedure. So that is the difference of a plastic surgery intervention. So even people who get small injuries on the face, small cuts on the face or bruises on the face, especially children or girls, they all would want a plastic surgeon to operate. The reason why a plastic surgeon operates these things are the eventual scar is much better. So there is nothing like scar surgery, but we can modify it and we can label it as a concealed scar surgery or a minimal scar surgery. So second important misconception is the minute we say we tell a patient आपको plastic surgery लगेगा, तो the patient thinks that skin grafting means plastic surgery.
Yes.
So the patient then asks, "We are going to remove skin from my thigh and place it to wherever the defect is." So well, skin grafting is one part in plastic surgery, or I would say skin grafting is one of the surgeries amongst the various surgeries under the spectrum of plastic surgery. So, plastic surgery, like I told you previously, even a simple suturing also comes under plastic surgery, a cut being sutured or a laceration being sutured, because the way we suture it, the kind of materials that we use, or the way the tissues are handled, and the eventual scar that's going to come. Right.
I'm sure patients also face some challenges especially during the recovery. They might face many things. So if you can just highlight a few and tell us that how do you help them in recovery?
Sure, that's absolutely true, and many times we don't realize what challenges they face. So, thank you for bringing that up. So, we try to give as many instructions as we can, but of course, patients tend to forget them. So, what happens is one important thing is patients, when we tell them now everything is healed, you need to have bath, they actually take her back because they don't want to believe that it is normal. So it really takes some time for us to convince them that please अभी जाके साबुन पानी से धोना है. Then we take the hand and we actually move the graft किसी कुछ नहीं हो रहा है ना तो इसको धोना है. So these things, but once the patient accepts that or understands that and is willing to get a better result, and there are a lot of small things that the patient needs to do during the recovery phase, which will help in the outcome to be very good, especially the scars. So there are moisturization is one of the very important uh, tool in the recovery period, because once the scars are formed over a period of next 1 to 1.5 years, the scars will continuously improve, but you have to supervise how the scar is improving and you have to give a lot of input. Now, as doctors, we are not going to be doing these things. The patient has to do this on a day-to-day basis. So, if the patient is dedicated to the scar and really determined to have a very good scar, the patient will get a good scar. The patient has to do very small things that we advise them repeatedly, and they do it religiously. The outcome is very good. And there are not just youngsters; there are some very old people who take very good of their care of their grafts, and they have very good results. So just applying a moisturizer twice or thrice a day, preventing it from sun exposure, using pressure garments which keep it nice and soft and smooth. These things help a lot in the scarring.
Right.
That's one thing about how the outlook is. Now, to improve the function after any hand surgery, patient has to really undergo a lot of physiotherapy. So it's not necessary that the patient has to go to a physiotherapist, but simple exercises that we teach them. And if they have a day-to-day target, that today I need to bend my fingers this much or this much or this much, if they try to have those things and religiously work towards exercising, they will just get full hand function back. So this
So
the
once
patient has
again,
to
determination works.
absolutely, and these are something which are possible. So
Right.
patient also has to believe in that.
Right.
So otherwise the recovery period is generally smooth, but yeah, these things are important and then come for a
And
frequent
will they get
follow-up.
guidance?
Right. And they come for frequent follow-up, so we also know, okay, when to step in or when to add something new, uh, or when to have another intervention. So
Right.
these things can be supervised, and then eventually they will do well.
So Dr. Lee, now we are also knowing that there are after all these challenges and everything about plastic surgery, it is a very common thing nowadays. People are getting more and more aware of it,
Yeah.
and I'm sure there are some recent advancements also which might have helped you and are helping patients also to get new and benefited results.
Yes, absolutely. So, recent advances again is like as technology is improving, healthcare is going to be improving because of the improved technology. So we have very high quality microscopes now. We have very good quality titanium instruments. We have very fine clips to control the bleeding from tissues. So these things have really evolved over time, and they have helped us evolve as surgeons. So, like some of the recent advances I would like to highlight is microsurgery and its increasing application. So, though microsurgery has been there from the 1960s, because of the improvement in the microscope and the sutures, we are now able to join very, very small body parts. For example, if the finger is cut at this level, even beyond this line, and you bring back that tip, we will try to join it back. We need to be just able to find the blood vessels. But high quality microscopes enable us to do that. So that's again replantation surgery. So in the past we used to join hands at this wrist level or forearm level. But now as distal as possible also we can attempt to join. Now as distal as possible also we are able to join, and thanks to the awareness that people come with those demands. So it also pushes us to improve ourselves. Second important application of microsurgery is like I was telling you about free flap. So we take tissue from one part of the body and transfer it to where the defect is, and then we join the blood vessels of that transferred tissue with the blood vessels available in the body part. So previously, so this process of free flap transfer has also evolved. We are using tissues from different body parts. So wherever we take the flap, we are able to get a good scar in that area. We try to conceal that scar also, and plus we are able to match the requirements of the tissue. So for example, if we need to reconstruct the lip, then we take a very thin skinned tissue either from the forearm or from the thigh. We thin it so that we're able to give a good shape to the lip. So this free flap surgery has numerous applications. For example, in burns reconstruction. Now, burns reconstruction is also old, from centuries it's going on. So previously when patients would have scars on the neck, and they have something called neck contractures, they're not able to completely extend the skin of the neck, and these scars would be released and we would resurface it with the skin graft. But that skin graft looks like a patch. It's always darker than your normal skin. But now with microsurgery, we use flaps. We use proper tissue from the thigh or from the chest wall, and we completely resurface the entire neck. So that gives a very good tissue match. The quality of that skin is far more superior, doesn't look like a graft, and the patients have a better range of function. So this is one important application of microsurgery. Similarly, in important areas like the axilla or the elbow where there's tissue deficit, we need good range of movements because they're all joints. So in all those areas, we can use free flaps. Second important advancement is diabetic foot reconstruction. So in the previous decades, I would say that any patient having a bad ulcer because of diabetes, invariably he or she would have to undergo an amputation. Correct. But now we try to save the foot as much as we can. How do we do that? So basically, we see how the blood flow in the leg is or the foot is. And in young, recent diabetics, if they've not had diabetes for too much time, they've come in early and the vessels are palpable, we can feel their blood vessels, then they are very good candidates of quickly cleaning the infected part and then covering it with a free flap. Or sometimes if the blood flow is not so good, we improve it with something called angiography, like how angiography is done for the heart. We can also do angiography for the limbs. Angiography is done to improve the blood supply in the limbs, and stents like we are placed in the heart blood vessels, stents are also placed in the leg blood vessels. Once the blood flow in the leg improves, then we cover the wound. So amputation will be the last resort when nothing works.
This is a big thing. This is a
Yes,
really big
this
thing.
is,
Diabetic foot is a very common thing, and
extreme.
amputation, I think, was the only cure.
Yes.